is Charmaine Craig, and I've just buried my dad, Charles David Craig, June 13th, 1941 to December 26th, 2021. He was 80 years old, and when he was 18 he joined the Army, and then after the Army he was a truck driver. He was a truck driver until 65, and he retired for like a month and went back to work until he was 73 and couldn't work anymore. He loved truck driving. He loved being on the road. I didn't see him all that much when I was younger, but I always knew he was there for me. I'm totally in support of the truckers against the mandate, and the healthcare workers against the mandate, and anybody else with the mandate. And so was Dad. When COVID started in the spring of 2020 and the lockdowns, the grandkids would keep the great-grandkids away from Grandpa. My daughter said she didn't want to be responsible for Grandpa's death. Now, we already knew he had end-stage emphysema, and he didn't give a fuck. He didn't care. He wanted to see his grandkids. He said, bring them over. In August 2020, Dad had his first visit to the hospital during COVID, and because he had emphysema, and that's a COVID symptom, so because of protocol, he was sent to the COVID ward, because our hospital is a COVID center, and they had a separate area for COVID, separate area. Anyway, they would put Dad in the COVID ward until he'd test negative, and then he'd supposedly be able to get to a regular room, but not until they had a bed, so sometimes he'd be there for like 10 days. In that time, they'd be allowed no visitors. It was just, I wasn't allowed to go in and advocate for him and say, you know, what was wrong, or talk to the doctors, so the doctors at least would call me, and that's where the doctor said he was definitely palliative end-stage emphysema. Anyway, so he'd come home for a bit, go back a different time, and again be put in the COVID ward protocol till he tests negative, and wait like 10 days to be moved or back home. Throughout the whole thing, we had the grandkids visit. We didn't care. He wanted to see them. He knew he was dying. And it's totally unfair to keep family away from the people who love them. So anyway, I moved forward to his 80th birthday, which I didn't actually think he would make it to, but he did. He's one tough old trucker. He made it to his 80th birthday, but the very next day fell and broke his ankle. Now he went into the hospital again, COVID ward, again, all the protocol.
And they didn't even keep them separated.
Yeah, for 10 days until they moved him to a different hospital. And when they moved him to a different hospital, into an extended care bed, which was much more lenient. They were still at COVID, like a checkpoint to get in. Unvaxxed could visit, but only one family member per day. They could go as many times per day, but only one per day. I did manage to sneak in the grandkids though, or the great grandkids, and that was fine. But it was time for, he had to go into a home because I couldn't look after him at home anymore. So he was at that hospital until he got moved into a nursing. Now, while he was in the hospital with his broken ankle, he had a cast, and he was there quite a while, and they did physio. And they would get him up onto a wheelchair or commode chair and bring him into the bathroom to help him. He could still walk, he could still get up, he could still exercise, and they did their best. And they would come when he had to go and help him, but they would put a diaper on him at night for just in case. So anyway, so then he goes into the nursing home after this, and they know that he's supposed to, that he can walk to the bathroom, but he needs help. He can sit up in bed to eat. He was fine. He could sit right up and eat. He could get up. He could use a walker, but he needed help to get up. And his boot was off by then, his ankle boot. Anyway, at the nursing home, this was all September. We were allowed to visit. Unvaxxed were allowed to visit. Family could visit, and we had restrictions. We'd get screened, and we were allowed to do a rapid test because that particular nursing home was one of the experimental ones that were given a whole bunch of rapid tests. And they rapid tested all their employees, because all their unvaxxed employees, because that was the thing. All healthcare workers had to be screened to go in to work, but the vaxxed workers did not have to be screened to go into work. They're vaxxed, they're safe. Anyway, everybody at the nursing home was vaxxed. My dad actually wasn't until he got there. So then they realized, it didn't take long to realize, that the vaxxed were giving the COVID to the vaxxed, because there was a ward. They knew, they tracked all the in and outs of all visitors, and the ward that had the COVID outbreak was all vaxxed visitors, all vaxxed staff. They knew, and they wrote a letter to Bonnie Henry that please hurry up with these boosters, which weren't actually approved yet with the FDA. Please hurry up with them, because that's gotta be why. So they ramped up screening there because they knew that the vax staff were giving it. So now they screened everybody going in, all the staff. But then on October 12th, the unvaxxed staff were fired. They lost 25 staff at this home. Dad could tell right away that they were short-staffed. Instead of just rapid testing everybody like they should have been, they let go of the staff. They forced to let go of the staff, and what we ended up with was Dad never got taken out of bed. He never got dressed. He never sat up to eat. He never ever saw the inside of the bathroom again. No going to another room. They never wheeled him into the community room, because I think they just didn't have time to ever take Dad. He never met other residents at the place. They never did physio. They never cleaned under the bed. It was disgusting. I dropped my phone once, and it was like grimy reaching under there. One time I went in, and his table tray, like he had, because he had emphysema phlegm, so the phlegm had spilt. It wasn't cleaned up. One time it was on the floor, and I went back and it was still there. Anyway, there was so many mistakes. His oxygen machine, the only time they ever got him out of bed was one time a week to have a bath. So they would take him for his bath. I know that after the mandates, my father died much he was dying, yes, but he died much faster because of the mandates. And he died a death with no dignity. He would call for help. When they've stuck him in a diaper, he knew he went to the bathroom. He had full cognitive ability. He knew when he had to go. He'd buzz the nurse, and nobody would come for 3 hours. 3 hours, and that's a man with cognitive ability. But imagine the ones with Alzheimer's that they put off. The loneliness and despair that he must have felt, confined to a one room with no social activity, his only company, the TV. Unable most times near the end to use his phone because his hands were so shaky. So he didn't, no staff to help with these little things. He had his own oximeter that I brought into him, and he could tell when he was low on oxygen. The nurses never knew. He knew and would tell them, then they'd check. And many times they had his oxygen on too low. And one time completely forgot to plug his machine in after his bath. He was labeled palliative, yet not actively dying. So he was not allowed unvaxxed visitors. Unvaxxed visitors with the loophole, you have to be actively dying. And they said because he's still eating, he's not actively dying. And he ate until maybe like the last hour. He had a McDonald's apple pie. Anyway, so that was at the home. The mandates really made him go downhill, and with absolutely no dignity. And then when he was taken to the hospital, it was when Bonnie Henry had said, no two households could get together if you're unvaxxed for Christmas. So while this was happening, we had 4 unvaxxed households that were allowed, luckily, to visit him, because one doctor had said he's dying and you better get down here. And guess where he was? The COVID ward. So you have 4 households walking in and out of the COVID ward. But luckily, thankfully, we were allowed. They did move him to a private room, and he did have a good last couple days. But we did discover that he went over 24 hours without his diaper changed. We did see the family members that stayed overnight, that the nurses rarely checked on the patients. These mandates are killing the old people faster and with less dignity than COVID will.